Hello and welcome to the English with Confidence podcast. I'm your host, Eric, and today's episode is titled Going to the Hospital, English Phrases for Medical Situations. Whether you're a patient, a caregiver, or just interested in improving your medical vocabulary, this episode is for you.
That's true, Eric. I'm Ruby. I've worked in hospitals across 3 continents. I'm excited to share practical English phrases and tips that can really make a difference during medical visits. Let's dive right in.
Absolutely, Ruby. Before we get into specific phrases, can you tell us why mastering English for medical situations is so crucial?
Certainly, in emergencies or even routine checkups, clear communication can impact patient care. Studies show that language barriers increase the risk of medical errors by 70%. Knowing the right words empowers patients to advocate for themselves.
Let's start at the beginning, describing your symptoms. Many listeners worry about not being understood at the hospital. What's the best approach to explain how you feel?
Great question. Use simple, direct phrases like, I have a sharp pain in my chest, or I've had a fever for 3 days. Avoid vague terms. Be specific about location, intensity, and duration. For example, my headache started this morning and is throbbing.
That makes sense. Would you say using analogies, like it feels like someone is squeezing my chest, can help doctors understand better?
Absolutely. Analogies paint a vivid picture, bridging gaps when vocabulary is limited. For instance, comparing dizziness to the room spinning gives medical staff clearer insight, reducing the chance of misdiagnosis.
After describing symptoms, the next step is check-in. Hospital receptions can feel overwhelming. Ruby, what phrases do you recommend for a smooth check-in process?
Start with, I need to see a doctor, please, or I have an appointment at 2 p.m. Be ready to state your name and date of birth. These are standard identification questions. If you're unsure, say, could you help me fill out this form?
And what if someone is in a hurry or an emergency?
In urgent cases, say, it's an emergency or I need help right away. This signals staff to prioritize your needs. Remember, clarity and calmness go a long way, even in stressful situations.
Let's transition to medical history. Why is it so important to communicate your past illnesses or allergies accurately?
Doctors rely on this information to avoid harmful treatments. For example, saying, I'm allergic to penicillin, or I have asthma, helps prevent complications. Even mentioning family history, my father had diabetes, can guide the doctor's decisions.
What if someone forgets a technical term, like the name of a medication?
Describe its use or shape. It's a blue pill I take for blood pressure. Even partial information is valuable. Bringing a written list is also a great backup, especially for non-native speakers.
Medical procedures can sound intimidating. How can patients ask about what's happening, especially if they're unfamiliar with terms like CT scan or IV drip?
Never hesitate to ask, can you explain what this test is for or what will happen during the procedure? Healthcare workers expect questions. You can also say, could you use simpler words if explanations feel too technical?
That's reassuring. Is it common for patients to bring a friend or interpreter to help with language?
Yes, and it's encouraged. You can say, may I have someone help me translate? Hospitals often provide interpreters if you ask at check-in.
Pain is subjective, and everyone experiences it differently. How can patients communicate pain levels so doctors truly understand?
Most hospitals use a 0-10 scale. My pain is at 8 out of 10. But also describe the type of pain. It's stabbing, not aching, or it comes and goes. These details help pinpoint causes. Visual pain charts can be helpful if you're struggling for words.
Are there cultural differences in expressing pain that might affect understanding?
Absolutely. Some cultures understate pain, while others are more vocal. Doctors are trained to read both verbal and nonverbal cues, but being explicit in English bridges any cultural gaps and ensures accurate care.
Let's talk about prescriptions. Misunderstandings about medication instructions can be dangerous. What's the clearest way to ask about dosage or side effects?
Ask, how many times a day should I take this? Or, are there foods I should avoid? For side effects, what should I watch out for? If in doubt, request, could you write the instructions down for me? This reduces confusion by 60% according to recent studies.
That's a smart tip. Would you recommend double-checking instructions before leaving the pharmacy?
Definitely. repeat back what you understand. So I take this with meals, right? This gives the pharmacist a chance to correct any errors on the spot.
We can't ignore the administrative side insurance and payments. Many find this confusing, especially international patients. What phrases are useful here?
Say, do you accept my insurance? Or, can you give me an estimate of the cost? If you don't understand a bill, ask, could you explain these charges? Some hospitals have patient advocates who specialize in navigating insurance and hesitate to request their help.
Are there standard forms or documents to expect?
Yes, you'll likely encounter a consent form and insurance verification. Asking, can you help me fill this out? Is always acceptable and ensures nothing gets missed.
After a hospital visit, follow-up is key. How can patients confidently schedule future appointments or check test results in English?
Use phrases like, when is my next appointment? Or, how will I get my test results? Many clinics now offer online portals. You can ask, can I access my records online? Which improves engagement and outcomes by 35% according to the CDC.
And if a patient needs to reschedule or cancel, what's the polite way to do so?
Say, I need to reschedule my appointment. Or, can I cancel and book another time? Clear communication helps clinics manage schedules efficiently and ensures you stay on track with your care.
As we wrap up, many listeners still feel nervous about using English in medical settings. What advice do you have for building confidence and self-advocacy?
Remember, your health is important. Never apologize for asking questions. Practice key phrases before your visit and write down concerns in advance. If you don't understand, it's okay to say, could you repeat that, please? Or, can you explain in another way?
That's empowering advice, Ruby. Any final thoughts for our audience?
The more you practice, the easier it gets. English is a tool use it to make your voice heard. And remember, healthcare professionals want to help you, so don't hesitate to speak up. You've got this.